Thank you, Mr. Chair. Mr. Chair, I ask unanimous consent to submit a letter from AIDS United, the AIDS Institute, the National Alliance of State and Territorial AIDS Directors, the National Coalition of STD Directors, and the National Minority AIDS Council outlining recommendations for a comprehensive approach to the monkeypox response. Mr. Chair, could I have unanimous consent for that, please?
Yes, so ordered.
Thank you very much. Thank you to our witnesses, and I want to add my gratitude to Dr. Fauci for your service to our country during some of our country's most challenging times. So thank you so much. I want to also start by associating myself with Senator Murray's remarks about the importance of Congress coming together to make sure the administration has the resources that it needs to respond to the monkeypox public health emergency. And I also agree on the need to sharpen our response and to work effectively with public health departments, including in Minnesota. Assistant Secretary O'Connell, we had a good discussion last week about distribution of the monkeypox vaccine, and I want to follow up on that. We talked about some of the challenges that the Minnesota Department of Health has experienced. The issue is that ASPR has opted to use the HPOP system, the Health Partner Order Portal, as I understand it, to distribute vaccines rather than the VTRAX system, which is how COVID vaccines were distributed and what the department is used to. As I understand it from ASPR's perspective, the HPOP system works better for distributing both monkeypox vaccines and treatments directly from the Strategic National Stockpile. There are also challenges with interoperability, as I understand it, with the VTRAX system. But of course, the issue, as we discussed, is that by using two different systems, one for COVID vaccines and one for monkeypox vaccines, this is a real challenge for the Minnesota Department of Health. And I suspect that this is a challenge for other agencies as well. Of course, this is happening at a time when these challenges are falling on public health departments and staff that are exhausted and burned out after the last 2.5 years of responding to COVID-19. And learning a new system in the midst of all of this is really a challenge. And it's sort of exacerbated, I think, by department having trouble tracking shipments of vaccines through VTRAX, and sometimes monkeypox doses just showing up unexpectedly. So could you just address for me, I appreciate you talked about this some in your written testimony, could you address what steps you are taking to work with state health departments that are in similar situations to Minnesota's to help improve how this distribution process is working?
Senator Smith, thank you, and thank you for the good conversation we had last week and an opportunity to talk about some of these challenges. So most important to us is that those that need vaccines can get them. So if anyone continues to find this to be a difficult system, please reach out and let me know. We want to knock down these hurdles to ensure that folks have access. We now have enough vaccine supply to meet demand, so it's important that people are able to access it. So we have a similar challenge that Dr. Walensky mentioned with the states. The states aren't able to use their COVID funding for the monkeypox response. We haven't been able to use our COVID funding for the monkeypox response either. So when it came to digitizing the SNS process, we were going to have to put new money into either the VTRAX system or the HPOP system. The HPOP system is currently being used in COVID-19 to order therapeutics. So states do have familiarity with HPOP. VTRAX was being used for the vaccines. Only HPOP could do both, and we were faced with putting annual budget funding into one of these systems in order to digitize the SNS ordering. And we chose to put it into the system that could actually do both. We believe that was an important step in moving forward, but we do acknowledge, Senator Smith, that our public health department colleagues are worn out and tired. We have had countless office hours with them to make sure they understand the system. If they're running into any problems, we're available to answer them. And as hard as this change management is, in the middle of two responses, it was the right thing to do to move forward to an interoperable system. We also have added additional distribution sites. That's one of the things we did with the SNS. We could not just piggyback on the COVID-19 distribution network. That was funded with COVID dollars. We had to go with the SNS, do an entirely new contract with a different distributor with annual funds and set that up. So that was one of the reasons why there was a delay. We've needed to overcome this, and would look forward to working with Congress on making response dollars more fungible in the future.
I know that that would be helpful, and I appreciate your continuing to work the department. And obviously, getting the distribution right is everything when it comes to getting vaccines and making sure that people have access to vaccines. Mr. Chair, I'm out of time, but I will submit a question for the record about the importance of tribal consultation to our witnesses, and look forward to your response.
Thank you, Senator Smith.